Sorry to keep you waiting, just a bit of technical difficulty on our end, but we're so happy that you are able to join us today in yet another SALI 6023 public lecture in a series of events commemorating the 60th anniversary of the Faculty of Social Sciences here at the University of the West Indies Mona campus. I am Dacia Leslie, course coordinator of SALI 6023, monitoring and evaluation of compulsory postgraduate course delivered here at SALISES as part of the MSc in Development Studies program. As a follow-up to yesterday's FSS at 60 symposium, which was implemented under the leadership of Dr. Lisa Vassiani, Associate Dean of Partnerships and Resource Mobilization, we now move towards deepening conversations centered on the importance of results-based management and the importance of the role of the social sciences. We will seek to achieve this through today's lecture entitled Sustainable Program Management, Hierarchical Causal Systems. But just before I introduce our guest lecturer, allow me to especially welcome all representatives from partner institutions, including the Planning Institute of Jamaica, and especially warm welcome to Mr. Easton Williams, if he's on, Senior Director of Social Planning and Research. We recognize at this time University Director Professor Audrey Henry Lee, Professor David Tennant, Dean of the Faculty of Social Sciences in his absence, SALISES staff, our vibrant MPhil, PhD, and MSc students, now looking forward to end of semester seminars and exams. Again, welcome one and all. It is with great pleasure I introduce to you our guest speaker, Bongs Lainjo, who is an engineer and results-based management systems consultant with over 30 years of experience working in various regions, including Africa, Asia, Pacific Islands, and North America. Bongs Lainjo is also a former UN Senior Advisor of Program Management, Reproductive Health Commodity Security, and Evaluation. Prior to this, he worked for USAID as a logistics and management information systems advisor. He also served as senior data management advisor for Columbia University after spending close to a decade teaching as a professor at a number of Canadian academic institutions. He has also developed and implemented thematic peer-reviewed models, including the program indicator system matrix. Ladies and gentlemen, I now welcome to the platform Bongs Lainjo. Please do give him your undivided attention, and I'm just going to encourage you to pose questions using the Q&A feature located at the bottom of your screen, and which will be addressed during the Q&A session following his presentation. So Bongs Lainjo, it's a pleasure to have you. The platform is now yours.
Thank you very much, Dacia. And let me start by, first of all, acknowledging sharing my gratitude to the University of the West Indies in Jamaica, and specifically Dacia Leslie, Richard Leach, and many others who have contributed to putting this all together. Needless to say that my sincere gratitude also goes to those of you out there who have actually rendered this activity possible. Without waste of further ado, I will start with today's topic, which, as Dacia indicated earlier, is sustainable program management, hierarchical causal systems. The question people ask me quite frequently is, why sustainable program? And the simple reason I always have, and I share this with people I talk to, is that when you look at sustainable in this context, there are two options. It's either an event or a process. Up to this point in time, many of the interventions that we have experienced or done are limited to events, but events can only go so far and only do so much. My thinking is that to make it actually long lasting and more rewarding to both the implementers and the beneficiaries, we should make it a process. The big question, of course, is when you make it a process, what are the limits? The guide in this context is that when it's a process, it continues. It's ongoing and it's continuous, this continuity. On the other hand, when it's an event, the moment you put the last stop on your attempt, everything comes to an end. We want to avoid that. And that's why I call it sustainable. And of course, in program management, we'll see more details. The next thing, introducing myself, is I do have a blog that is titled Contemporary Challenges. And in my blog, many of you have had access. There are many, many sub-themes ranging from the benefits of nature to Canada's complicity in slave trade. Yes, indeed, here in Canada, we also have the blood on our hands. So there are many of these issues that you'll find on my blog that you may find interesting, and they will tend to give you a break in some of the things that you want to do. So now moving on to the next slide, it's a program outline of the issues that I plan to share with you. They are, of course, not exhaustive, but they give you an idea of some of the challenges and some of the complementary attempts that are existing out there. And also, as we go through this, bear in mind that there are going to be occasions where I use the same word over and over, or I use some words interchangeably. For example, a word like intervention. Intervention is what we either call program or project. So I use that interchangeably. And then we'll go through to also some of what defines vulnerability. We're looking at certain communities and try to improve their social economic dynamics. In addition to, you can also call that as an attempt to improve their quality of life. So these are words that I would be using interchangeably, and I hope that I don't get you confused. But if you do, of course, there are two options, either through this conversation with you, or you go to my website and leave a message on my blog, and I will always get back to you. On the outline, the first thing we're going to look at is a background. The background is an attempt to focus and try to put together a framework that puts all of us on the same ground and on the same attitude. It gives us a common understanding of what do we think about the problems out there. I hate to emphasize the word problem because it makes it more pessimistic. And I'm a firm believer in the glass being half full. So even though I may be coming up with these issues occasionally using those words, the bottom line is we have achieved and there is room for more achievement. Then the next thing in the presentation, I would present highlights to you, which I identify key issues that still exist and that we need to look at. Instead of just making it an open check, we highlight those challenges that we believe are very close to us and to people that are very close to us. Then the next thing is I'll give you the objective of the presentation, and we look at what is it indeed that we want to achieve and in what context. That will be highlighted in the objective. This will be followed by the relevance. Having found out what the objective is, what in our mind do we sincerely consider as the relevant issues that we need to highlight? Then following that is the target audience. Who is this presentation made for? And while I use the word presentation, it's actually the book. I have used now this title as a title of my current book. And you can find this in Amazon or some sellers in the US. Unfortunately, they don't, Amazon doesn't mail that overseas. but anybody who wants to have access to a copy can always get back to me. And in the target there in the book, for those who have the opportunity, it's quite inclusive. And I will highlight that as we move on in the presentation. Then I summarily share with you what a program lifecycle is. There are many versions, but I try to share with you one that I tend to use more frequently. And following that would be the themes. What are the themes that we believe are included in trying to use this program or this model to sort out some of our challenges? They include a variety of themes, including, of course, the sustainable program that the UN has, and that we're going to look at starting from the MDGs and now with the SDGs. I will share the SDGs with you, and you would see how they consistently reflect the themes that we're trying to deal with in this context. Then we look at the program definition. Again, as I said earlier, we look at programs, we are either looking at interventions, we're looking at projects, or we're looking at programs themselves. Different people have different connotations, but I try to highlight to you my approach in terms of what I have put together and sharing with you. We'll see at what the definition is. Then we will look at the model determinants. The model determinants I will show you a graphic view of the model itself. We will see the determinants, see how there are linkages in the determinant that connect the different levels. The determinant, by the way, are elements that are included in a ladder or a pyramid. I will go through the details of what the pyramid represents and how you move from one level of the pyramid level to the next, and how it helps us attain some level of success or accomplishment. And then we move on to the model definition, of course, that I will get to share that with you. And you see Carrot Bus is actually the name of the model, and we will look at some justification. Then I go through a series of discussions that will be followed by a conclusion, and I'm hoping that we can get that far. And at that point, we would then call it a day. Let's move on. Now, as I said earlier, the first thing is we look at the background. And the background starts with some history. And believe it or not, the challenges that we're faced with now have been with us for close to 3 generations. That's a long time. And while, as I said earlier, there have been some successes, the challenges are still enormous. People are still suffering. There is still a lot of poverty. And with the COVID now that we're faced with, things have even been exacerbated by its arrival. And people are now in dire straits. And the big question is, what does the future hold for us in terms of trying to alleviate these dismal conditions that people are faced with? Now, as we go through this, I like to remind the listeners that the conditions we're dealing with are not simply limited to poor countries. In Australia, you have the Aboriginals. In the States, you have also the Aboriginals. But here in Canada, we have the challenges. If you go to any of their communities, you will not believe the quality of life that they are experiencing. And so when we look at problems and poverty and the gap that exists between the very rich and the very poor, let's not just forget and start thinking that it's only the poor countries. It's global. And the level of poverty and suffering has no boundaries. It's universal. Keep that in mind. And while I do, so my approach to that definition is generalizingly using it as vulnerable communities. So when I say vulnerable communities in this context, it's just about the developing world. It's not about the poor world. It's not about people who are living in dire straits or extreme poverty. It's about a universal challenge that we have to deal with in terms of inequality. And this is something that should touch everybody. People like me with very humble backgrounds, we do have an idea of what some of these challenges is. What we don't know is what is the solution out there that works for everybody? I don't know already. There are, I believe, reasons to believe that only target interventions are the way forward. Now, the next thing is that after all this time, lots and lots of money have been spent by the rich countries trying to help, quote unquote, help. And for a significant part, there continue to be challenges. And things are becoming more and more difficult now from the rich countries because their taxpayers now are beginning to raise their voices. You all know about the demonstrations out there from different aspects of social dynamics. And helping poor countries is no exception. Countries of taxpayers are now putting pressure on their members of parliament, asking them to account. Where is all this money going for? And it's easier for a taxpayer to say, for the government to say, oh, well, since we are really not quite sure what the details of what we are doing are, let's just cut it. Take an example. Not too long ago, the British government, what did they do? They reduced their foreign aid funding to certain countries. And that's again against their own promise that they were going to try to get as close to 0.7 of the country's GDP, 7% of the country's GDP in helping poor countries. That has not mixed, that has not worked. And so what we see at this point is, yes, things are going on, but our experience is that the outcomes continue to be mixed. And remember, just helping is not good enough. When you help, it's necessary, but it's not sufficient. What do you get out of that help? What kind of outcomes do you get out of that help? How does that improve people's quality of life? How does that improve people's way of living? These are big, big questions that they don't tend to answer. It's easy to say millions and millions of dollars have been given to country X. The bigger question is, how have those amounts improved the way country X operates? One of the things that comes with these mixed outcomes is that people have their own agenda. By people, I mean these rich countries. They have their own agenda. And they go there with their own programs. They go there with their own quote unquote standards. And so it becomes more difficult to assess how much of what have we done is actually meaningful. How much of what have we done is either complementary or consistent with what the other donors, funding agencies are doing. We do not have that measure. And that has created more confusion, more problems, and a lot of suspicion out there, both from the giving and from the receiving side. So let's bear in mind, these are also challenges that we have to live with. But of course, needless to say that significant gaps still exist between different implementing agencies and funding agencies. By implementing agencies, we mean those agencies that are out in the field doing the implementation of what the funding agencies support. But then, of course, the bigger challenges that come on at this stage is how much of the input that they have put together comes from the beneficiaries. It's a big question mark. The standard that we need to leave it. Having said that, an interesting declaration that came on several years ago was what we call the Paris Agreement. The Paris Agreement was an attempt by many of these rich countries to standardize, to try to establish a consensus, and to try to optimize resources in an attempt to identify some key results that they can bend on. And all these meetings and declarations and conferences have ended up just being that. At this point in time, everybody is still on its own. By everybody, I mean the donors and the funding agencies. And the attempt that they try to put together to establish some degree of success is still up in the air. And that leads us to the point, why is this happening? Because people do have their agenda. Again, by people, I mean these donors. They have their agendas. And the biggest question that they tend to ask themselves, I believe, is what is in it for us? True, we agree that they're trying to help vulnerable communities, but something bigger is what is in it for us? So when you try to introduce an element or an organization that would try to coordinate, it's a dead on arrival because there is a lack of consensus, there's a lack of openness, and people are still emphasizing their own benefits as opposed to benefits that are shared by the communities. So coordination becomes a very big issue. And then, of course, in addition to that, because of poor coordination, lack of understanding, and lack of consensus, there is the challenge, which is there are significant levels of duplication. Why is that so? Because in many cases, many of these donors, they tend to say, oh, well, this is going to fit us well, as opposed to let's avoid doing things that government X is doing so we can expand. That is not happening. People are only saying us first, us by us, I mean donors first, and then the rest can come later. So you do find that you go to one country or one community and you find lots of these interventions, two, three or more that are duplicates. Government X is doing that. By government X, I mean the funding agency X is doing that. And the funding agency Z is doing that. And they're doing the same thing in the same country, though in different communities. So that becomes an alarming challenge. And you ask yourself, why can people do that? We do know, of course, that the challenges out there are enormous, but the strategies that are existing have not actually minimized or mitigated the level of duplication. And that's still a big problem. And then one issue that comes up in terms of duplication is there are lots of vertical programs. Vertical programs simply means you get one and you send it right down to the community. And in between that, there's hardly any understanding of what are the neighboring communities experience in terms of that help. No. And vertical programs are actually quite limiting. They're actually restricted and they're actually confined to certain communities. And that's something that to the extent possible need to be avoided. Aha. And this is one other big challenge, the top-down approach. Now, the model that I'm going to share with you is called the bottom-up approach or bottom-up strategy. Bottom-up strategy as opposed to top-down approach, there are two contradictory or adverse approaches. Top-down approach, you start with these donors with all the money they have, they contact intervening government, recipient national governments, they agree on what they believe, quote unquote, believe is required for the country. Donors give just tons and tons of millions of dollars, and they go down and they impose needs on the community with no regard to what is the community contribution, what is the community take or perspective on what we are doing. And then within 3 to 5 years, they finish their timeline, they get their money, and then it's done. And the community is back to where it was. That top-down approach is something that we significantly need to discourage. And it's something that I do highlight very in big terms in my model. We'll see that as we go along. So then there's another issue that comes up. When all this is said and done, different funding agencies or donor countries, they come in and say, we did that, we did that, we did that, and this is the outcome. And the bigger question that comes on is, how do you establish a level of attribution? How do you know that funding government Z should be given the support and actually associate them with intervention X, or government Z is also claiming that they're also part of it. So that becomes a big, big problem. And because of this big fight trying to grab what I have done and what I believe, by I mean the government, funding government, is my effort, it becomes a big, big challenge. That should not be an issue. Priority should be let's work together. Let's put our efforts together. And the key should be, who are the stakeholders? Who are the vulnerable members of the communities? These are issues that we need to highlight in any of these interventions. And then as final issue of a background, I recommend or I do support that there is a strong need to get models, functional models, practical models, pragmatic models that can help establish some level of sustainable health in terms of how our programs are managed. And that's why in this presentation, I'm sharing with you the model that I call carrot bus. Carrot are the different determinants that we're going to go through as I present the model to you, ending with the word bus. And as I say, bus is standing for bottom-up strategy. Bottom-up strategy is the future. And in this research that I'm actually highlighting the model, it's more qualitative with significant efforts to use secondary data. So most of what I will be sharing with you will be driven by those factors. So what are the highlights? Now we've seen the background, and I've tried to share with you some of the issues that we are faced with out there in the field. And none of those issues is hypothetical. They are real, they exist, and they have created so many levels of confusion with trying to help the vulnerable groups that there is need for good housekeeping. There is need for significant effort by both the senders, the donors, the recipient governments, and even the stakeholders to try to do their housekeeping and make sure that the basics are addressed. Let's not go out there and start fighting with each other. Let's not go out there and try to figure out who did what. That's not important. The important thing is, how has that benefited our vulnerable communities? So highlights of the model that I'm going to share with you include the fact that it's hierarchical. In other words, you start from one level, in this case, from the bottom, and that's why the bottom-up strategy starts, to the top. I'm going to share the details with you. The second is that it's based on Abraham Maslow's hierarchy of needs. For those of you, especially sociology and psychology students, you would do recognize with Abraham Maslow. And my model is conceptually based on Maslow's model. I will tell you how. And then, as I indicated before, it is inclusive. Why nothing is written in gold, there is potentially everything in that model for everybody. If you go and look at the model and you believe that this is a level where you practically believe would help you improve your intervention, go for it. If you believe that you need to start from the bottom, we're going to see where the bottom is. And that is very consistent with Abraham Maslow's thinking. Maslow says at the bottom of the hierarchy of the ladder, there is basic needs, basic human needs as the first determinant. And in my model, I would show you that too, what my own basic, quote unquote, basic needs are and how they move in hierarchically. And that's why the model is called hierarchical model. You move from one level to the next level, to the next level until you get to the top. And once you get to the top, and that is not easy, it's not for everybody, but it's a symbol, or at least it is an indication of how much success you have made. Remember that. So the model is inclusive in that context. It's also holistic. Holistic is that it has tried to incorporate many of the issues that come up in program management, as many as possible. Not exhaustive, but it's quite holistic in its approach. And you will see that as we go through. It's also generic. It's not just for one theme. It's for multiple themes. You just need to look at the model and see how what you're trying to do fits in. And without forcing it or without preempting your approach, you try to adapt your needs, your themes with what the model has, bearing in mind that it's a long journey, but you got to start low You got to start simple, and then you move on the ladder, you move on the pyramid, move on the different steps, and see how much of it you can accomplish. And then, as I say again, if you haven't gone through Maslow's hierarchy of needs, check that out. And as you go through my model, you will see how consistent the different levels of the ladder are and how they're related to Maslow's. Conceptually, by the way, I need to remind that. My model is also causality based. Like in Maslow's case, Maslow says, based on human needs, as you get one level satisfied, you move on to the need. In my model, I say, once you have achieved a certain level, starting from the bottom, or starting from whatever level you believe you need, you move on to the next. And how do you find out where you are and where you need to be? I'll discuss that with you in the model. The determinants are well defined. Now, what I have also done in this model is that I have identified a certain number of determinants and defined them before applying the different levels of the pyramid. Now, this of course is not written in gold, but it's like saying, well, I need to know where I'm going, but before I do, I have to agree on what are the different essential elements of what I need to do. As I said, the elements are not written in gold. If anybody is trying to implement the model, they are free to have their own definitions of those determinants or those levels of the model. Now, what of course is not recommended is do not try to define those levels after they have been achieved, because that defeats, it contradicts motivation. And then it's also called fights against your pathway. You want to establish a pathway with those definitions and follow that very strictly. Now, you don't necessarily need to use my own definitions. My definitions are very simplistic and are based on literature review. And if you agree to use that, you keep those and you move on as you implement your intervention from one step of the ladder to the next. And the choice is yours. Now, one highlight that I need to share with you is that as you move on from one level to the next, you look back. In retrospect, you try to find out what are the lessons learned. That you can do, because the lessons learned, they help you improve the next level of the ladder. You don't want to duplicate approaches that have not been successful. And you use those lessons learned to improve your next or your current step of the model. Bear that in mind. As I said before, the characteristics of these models, of these determinants are unique. And why are they unique? Because they're based on literature or based on research findings that are driven by specific definitions. As I say, they are not written in gold. If anybody feels that they have definitions that are different, but they are going to stay when they start their activities, from when they start to when they end, it's fine. And that's what makes the model, again, more flexible. It's an original design. By original design, it's not like a model that is picked out of what somebody designed in terms of research, evidence-based, and used it. No, this comes out of a series or a combination of efforts over 30 years that I've had in this area. My experience, discussing with colleagues, discussing with experts, and as I indicated earlier, contributions from literature and look more in terms of qualitative research and using, again, secondary data. That I have found very helpful, and that has contributed significantly to the model that I'm going to share with you. So yes, it is original, and it's based on these support mechanisms that I have used to try to put it all together. There would be questions, of course, and like in Abraham Maslow's case, his model was criticized, and one of the key criticisms was that it was not culturally sensitive. And I don't have every reason to believe that not everybody will be satisfied with the model, but there is a significant amount of people out there who know about interventions, about programs and managing them, who would look at it and say, oh yeah, I believe there's something out there for me, or I believe there's something out there for us that we can actually pick and use. This is the idea. And I'm hopeful that many of you who have the opportunity to visit it would look at it in that context. And next to that is the elements and the determinants, they are all practicals. And it's the advantage of the model. For many of you out there who have been faced with the challenges that I've been discussing all along, you will resonate with almost everything that comes up in the model, starting from capacity building to right up there to transparency. You all know what that is. All I have done is I've tried to structure or standardize them by using certain definitions that are supported by literature. That's the only difference. But in terms of terminology and words, you would easily resonate with what I have. And you would then identify the practicality, how practical some of what you have out there is. And that's important. The other thing is that it's logical. You know, this is what I talked about causality. If you go to step 2 without having done step 1, there's a good likelihood that step 2 may not be operational. But if you do step 1 and then you move to step 2, you can then almost certainly say that step 1 has helped in contributing to step 2. And that's why my level of causality comes in. And the choice will be yours. The other issue is in the model, you don't have to start from step 1. You can start from any step. And the big question that always comes, which I'm going to address, is how do you know what step to start on before you move on? I'm going to share that with you in the next several slides. And then finally, in terms of the highlights, we have the comprehensiveness. As I indicated before, it's quite holistic and also inclusive in terms of who can do it and what can be done. So yes, it's not exhaustive, but it's quite comprehensive. So now the next slide is about the objectives. The general objectives are to strengthen and standardize program management protocols. Now, when we look at about strengthening and standardizing, we do realize, first of all, that there are instruments out there. Now, the challenge with those instruments out there is that they are just very, very, very haphazard. People go on and they would say, what is the problem? And because of the limited time in implementing programs, they have makeshift or piecemeal approaches that do not last. Now, what do we mean by standardized protocols? I do not mean here that we're looking at one size fits all, no. You go to each vulnerable community and you first of all go through the different processes of accessing what it needs, or making sure they're part of the team. And then you try to find out what are the key standard strategies within the context of that community that would help you enhance your efforts. That's what we mean by standardized protocols. And the next general objective is to address existing nuances, highlighting the synergies that exist among the different hierarchical levels of the model. So basically what I'm saying here is that the model is driven by different levels of achievement. And once you go through and try to isolate one from the other, trying, of course, to remind yourself that there are linkages, it gives you a good attempt to convince yourself that your efforts are not just meaningful, they are practical, and they are reasonably achievable. Because remember, cost is an issue when you're trying to implement interventions. And you bear that in mind. You're dealing with a budget, it's not just an open check that you're giving it definitions. You're also giving definitions that are practical. And they help within each level. That's where the synergy comes in. They help within each level to improve your attempt. What are the specific objectives? First of the specific objectives is to streamline program management by improving and refining causal links at all hierarchical levels. As I said earlier, the different determinants of this model are hierarchical. Just like in Maslow's case, you move from hierarchy of needs and you move from different basic needs and you move on to the next till you get to self-actualization, which is the highest level of the hierarchy. In my case, you try to make sure compartmentalize your levels so that they are not contradiction. You don't go to, say, capacity building, and you find out that it's actually competing with the next level of the model. You try to avoid that. Sometimes it's quite difficult. But the essence is that once you do have a more complete picture of what you've done at each level, moving on to the second level becomes a lot easier. And one of the advantages is that this also mitigates program duplication. I did indicate to you that you go to many different vulnerable groups or communities, and you find 2 or 3 funding agencies or donors or national governments doing similar things for the same population. We try to avoid that. And this model helps you do that. There are authentic contributions between different hierarchical levels. In other words, before you move from one to the next, there is definitely a contributing factor that helps you achieve the next level. And so you're not working in isolation. You're looking at different linkages and how their chains are established in terms of one supporting the next. That's very important because the idea of studying from one to the next is you're building a framework that will enable you move on to the next level of your ladder. Now, there are also meaningful synergies among different hierarchical levels, emphasizing systematic and logical implementation. Again, as I said, there are causal linkages, and you also need to realize that for each level, you try to identify what are the key factors, what are the key elements that interact among themselves. But then, of course, that interaction is driven by efforts that are coming from the preceding level, from the antecedent. Say you're dealing with capacity building, and now you're at the level of, say, accountability. You don't account if you haven't had the capacity built. So there's an inherent, and in some cases, excessive efforts that are driven by the previous level that help you move on to the next. So keep that in mind. Also, in terms of specific objectives, we try to strengthen and standardize the program design and management. As you all know, for each program, there's what we call a strategic framework. This model also helps you evaluate or substantiate the effectiveness of your strategic framework and how does that affect your management dynamics. These are issues that you need to look at. They promote a common key understanding among key actors. In other words, you and I are actors, whether we are stakeholders or whether we are even national governments, or even whether we are beneficiaries, we all have a common understanding of what we are doing, where we are, and what our potential challenge is by simply looking at the different levels of the hierarchy of the model. And finally, there is a minimized attempt of cost and optimizing the level of understanding among different holders. I said to you earlier, all these efforts are driven by cost. The bottom line is how much does it cost? So you've got to keep that in mind. Indeed, models are useful, but models are also as effective as they are cost effective. So these are very, very key components that should not be considered in isolation. They should be part of your attempt to improve people's quality of life, to improve socio-economic dynamics that exist among some of our communities, to mitigate the different level gap that exists between the 5 percentile and the rest. It's very important that we get all these things in perspective and try to approach them from a practical view. And also, as I said before, be aware that while there are costs involved, we want to walk out as intervention activists, not just activists, as people who are intervening with a very satisfactory idea that we have indeed made a difference between when we got there and now that we're moving out. So basically, you're looking at the baseline and the final line. These are issues that you need to put in perspective. Final line does not mean the initiative or the activity or the program or the intervention is over. What it means is that our presence there as support systems is now been handed over to the beneficiaries. And that's what I meant earlier in my presentation by saying, look at sustainability in terms of event as opposed to process. Here we emphasize process. The fact that we've reached 5, 6 years of intervention, it doesn't mean that it's ended. It continues. The process at a macro level continues, and that's the key. Okay, the overview, strategic program management overview. There are 7 components that facilitate the achievement of sustainable management of a development program. And they are embodied in a conceptual framework called Carrot Bus. And Carrot Bus is the model that we are going to see in details. Carrot stands for capacity. A is for accountability. First R is for resources. Second R for results. O is for ownership. And T is for transparency. And that's the acronym CARROT. Bear that in mind as we go through our pyramid. And all these are driven by an element called the enabling environment. What that simply means is whatever your determinants that define your model, those determinants are operational only if there is an enabling environment. And what does that mean? We'll find out details as we go on. And then, of course, there is the bus. As I indicated to you earlier, we are actually staying away from top-down to bottom-up strategies. And this model is a bottom-up strategy. So remember that. In terms of the overview, the holistic and causality model is conceptually synonymous with Abraham Maslow's hierarchy of needs. I indicated to you. Maslow's needs are from basic needs, basic human needs, that's it, to self-actualization. And then in this case, my model, it starts from capacity building to transparency. We're going to conceptually see how they both relate. Each step of the model has a well-defined description, strategy, and case study. Unfortunately, we will not be able to go through the case study because of time limitations here. And for those who have an opportunity to get my book, you will see that in the book, for each level of the pyramid, for each level of the ladder, there is a case study. That is, this is where what I meant by saying that the research is driven by qualitative research and secondary data. And that's what I have used to illustrate or to strengthen definitions of my different levels of the model. Now, who is this model geared towards? There are many, many, many interested parties that can use this model. They include funding agencies. By funding agencies, I mean different governments from rich countries that tend to support poor countries, quote unquote, poor countries. And this will be helpful if they themselves at their level get a better understanding of what they are doing. And in some cases, you will not believe it. I have an experience where I've worked with many governments. And in one case, I was in one of the recipient countries. And the donor country had given them conditions under which they were going to fund the intervention. And one of the conditions was that the recipient government, by recipient government, I mean the vulnerable groups, they had to design special data collecting forms for that funding agency, for that donor country. And they got stuck. And so I go to the country and they say, this is a challenge we're having. We have so many forms out there. They're not even using them. They're not even filling them. We are not even able to analyze data that are collected. And now we have a precondition from one of these donor countries, I would like to keep the names anonymous, requesting us to design more forms, and only through that process that they were going to give them money. And guess what? They were stuck. They didn't know what to do. And they said, can you help? And I said, fine. Before I help, it's no use talking to the government representatives in that country, whether the embassy or the developing aid department, because they have a better understanding. And they were not able to explain to their national government what the implications were. So I then got connected to this government, and I talked with the office or the department that was uh, handing out the funding, and I explained to them what the implications and complications were, and the consensus we arrived at. And believe you or me, it was only after that consensus that they started sending in funds. Was I indicated to them that while the current data collection instruments are not geared specifically towards that government, whatever the government wants can actually be isolated, identified, and included in compiling data that they require. And it's only after that intervention and explaining that to them, they had no idea what they were talking about. Even in terms of the forms that they were requesting, they didn't know what they wanted. So after I explained all these details to them and the implications of what it takes, because their understanding was all the forms are already there in the headquarters and all they need to do is send them copies. And I said, no, it goes beyond that. You have service providers that need to compile the data. You have other staff members that need to collect the data, first of all, that need to compile the data, and need to present them in reports. And these are activities or initiatives that are done at different levels. And it starts from the fundamental level, which is the health facility level, and it moves on to the national level. That takes time, it's rudimentary, and it's very labor intensive. They didn't know that. And so once I got them convinced, the funds then started flowing. So I'm just sharing with you now how these funding agencies need to be involved to get a better understanding of the dynamics of efforts that are being put in the field to help people that are in need. Then also the implementing agencies. Implementing agencies at this point is we're referring to people who actually implement the initiative. They are the funders and they are the implementers. They could either be national or they could also be international. They also would find this model interesting. And of course, there are program managers. Program managers are those who oversee the daily or the routine activities that are involved in program management. And then there are also stakeholders. Stakeholders could either be part of the team or could be just key informants, if you wish, or could be just active participants that are also contributing to the initiative. And of course, there are program evaluators, because one of the things that you find when you go to evaluate program is there is a challenge between the need of the evaluators and the need of those who are reporting. Many program managers, or if I wish, program agencies, they put together quote unquote generic terms of reference for those of us who come to conduct evaluation. For example, they would say use this OECD approach in terms of what you would need to account for what has been done and what has not been done. And then you go out there, I do remember many of the cases that I went, we're talking about impact. And in one of the programs, they were asking me to assess all the activities from the output to the impact level. And they were expecting me to say that, to tell them if the impact was a success or not. And in several cases, what I do tell them is that given where you are, what you have accomplished and what you're expecting, there is actually very little to say about impact. And then they shake their heads and say, oh, but how is that? So that's another long story. I'll keep it at that. And then, of course, there are developing agencies. For example, you have the like USAID is one of the developing agencies, and there are many out there that you would know. They would also benefit from this model. And there are all, of course, a lot more. I just limited the list to a few. Now, this is a very simplistic approach of program life cycle that I tend to use. And while it's not exhaustive, it tends to cover many of the considerations that one needs to put in place when putting together a program life cycle. And here, what we do is you start by conceptualizing, of course. We are going to see details of conceptualizing there. And then the next thing is you put together a design. And the design, you're looking at what are your strategic frameworks and how do they fit. That's your program design. Before you start looking for money. Once you put that together, then It's more simplistic here, of course, but I'm going to try to share some of the details with you as we move on. But then you start looking for funding, and that's one of the difficult parts because these funding agencies, they come up with all sorts of complications. They come up with all sorts of requirements. And part of it being that they try to be as complete as possible. And of course, some of them do that because they report to their taxpayers. It's not just money that they pick up the street, it's money that people actually pay as taxes. And they try to make sure that to the extent possible, these funds are well spent. And then, of course, there's the inception phase. The inception phase simply streamlines what you have in your strategic framework and then presents a methodology. How do you plan to accomplish that? And once you've got that established, then you move on into implementation. And implementation, of course, is a bigger challenge because you're now saying, I have a good picture of what I have, of what I need. I have a good picture of how I'm going to accomplish it. And I've just finalized my methodology. But of course, remember that when you talk about methodology, it's very fluid because methodology is what is an assumption, it's what you believe will work. Then once you get out there to the field, you see some challenges that were not anticipated. And then you start, as I indicated earlier, putting together lessons learned. What are these aspects that I did not consider that make up part of what I need to, part of my implementation? You do that at the implementation level. Now, I've used the word sustainability. I hesitate to use the word sustainability because defining sustainability remains quite complex, it remains quite difficult. And I would just summarily represent that word sustainability with event or process. At that level, try to make it a process instead of an event. In other words, whoever is implementing the program should try to make it a process instead of an event. So I like to avoid the word sustainability. And then we move on to final evaluation. I put final evaluation, but this is a common understanding. Many intervention agencies, they tend to have two. Midway through the program, they have what we call the midterm evaluation. The midterm simply says, now we're halfway through our journey. Are we doing it right? What are we doing wrong? And then you can always refocus. And that's at the intervention level. You can always refocus after you do a midterm evaluation. Some implementing agencies say, oh no, we're not going to go through that at this point. Let's just go through and we finalize. There are pros and cons, and I'm not going to go into the details. But of course, you know that doing two is better than doing one quantitatively. But the choice is, it also costs money. And so these are aspects that one needs to look at. It costs money, there are logistics, and there are also additional resources like you need to do two evaluations. So they tend to use one and they get away with it. And then finally, after you do the final evaluation, you look at the pros and the cons. Many of them tend to be quite negative. And I do remember one that I conducted, they almost threw my team out of the room because we had used some conclusions that the country didn't think they were appropriate. And to the extent that I now look at in hindsight, many of them are right because you put a lot of effort trying to do the best you can to accomplish certain objectives and hope that they're helping communities. And then you get a team of 5, 6 experts come as evaluators. You give them 3 to 5 weeks to tell you the story of what has been going on for 5 years. It's not possible, but that's the nature of the business. So that's a program life cycle, and that I'm hoping that would help to conceptualize your approach in terms of what the needs are and what you are anticipating. So now I indicated before that it was quite holistic in terms of themes. And I have indicated, I've added a few here in addition to the SDGs that I'm going to share with you later. And here we're looking at health. Health, of course, is very diverse, and you can look at health from different perspectives. There's also education, the same thing. You can look at education from different levels. There's also the environment. It's also part of the SDGs. And there are governance. I hate to put the word democracy when we talk about governance because I think it's overblown, especially when you're talking about vulnerable communities where they cannot even afford a meal. They cannot even afford to get out of bed in the morning because they don't know what they're going to eat. Are you telling them about good governance? It's good theoretically, but from the practical point of view, I think that we need to either use a different word or try to highlight what is more helpful to the communities that will work. Governance to me remains quite good. Governance is good, but democracy as it is quite icy in terms of applicability. And some countries have tried to use that as a precondition to give money to countries. And the recipient governments are quite smart. It's all right, this is what you want, we'll do it. But guess what? Go to the field and it's a different story. And then, of course, you're looking at poverty. Poverty, of course, is eliminating poverty as one of the SDGs. We use that as a theme. There's judiciary, there's agriculture, social security and protection. And then following that, as I indicated to you, I'm sharing some of the strategic development goals as some of the themes. There are 17 of them, ranging from eliminating poverty to partnerships for the goals. So take your pick. And if you take any of these, they would fit very, very smoothly into that model. And the choice is yours, but it has to be very, very carefully designed. And the design has to be based on knowledgeable experience. It has to be based on good background. And it also has to be based on results. What do we plan to achieve? So these are all the themes, now including the SDGs, that will fit in very well in my model. Now, what are the principal components of development? Now, what I have here is I do have some highlights that I would share with you, and they include conversation of the ecosystem, development of sustainable society, conversation of biodiversity, control of population growth, conversation of human resources, and increasing participation. Now, these are by one of the authors that I contacted, and that was the definition. And what does that author mean? I will share the details with you by conversation of ecosystem. It's simply looking at conserving ecological systems and preserving the aquatic and terrestrial ecosystem. That's the definition of ecosystem. Developing a sustainable society is a balanced diet, healthy recipient, health services, quality education, employment, among others. And what's the definition of conservation of biodiversity? Focus on conserving natural resources as an essential aspect of to protect human beings. And controlling population growth enables optimal utilization of available resources. This word controlling of population growth is quite controversial. From my experience working in the field, when we try to promote family planning methods, the general concept or the general understanding is family planning is meant to control population. So I tend to shy away from controlling population. And what has been my response to that? My response to family planning is not controlling population. It may be an inherent part of it, but in reality, we're trying to provide a better quality of health for the mother and the child. That's very important because this idea, I also remember going to countries where HIV/AIDS was a big talk. And you say, why do you want to try to promote family planning when all our kids are dying because of HIV/AIDS? And we keep on saying it's same for the same reason. While HIV is there, a big challenge, you also have to maintain a good quality of health for yourself as a mother and for the child. Now, conversation of human resources. That's also one definition by the author. And when you put all this together, you would then tend to find out that different definitions reflect different ideas. And what I try to do is, instead of getting one from one author, I use one from many to try to make my program more inclusive? Now, the next thing is we're moving up to program definition. I do have an algorithm here that goes through program definition. I'm not going to go into the details because some people find it a little more complex and discoursing. But in summary, what we mean by program management or program definition is we're looking at an intervention that is either broken down into a program or a project. The bigger question is, what's the difference? The program is a whole, it's a macro. And at the macro level, you have sub-programs. And this is what calls it projects. So from the context of this algorithm, projects are actually sub-programs. And then in the final analysis, if all you have is a program and no sub-programs, then you can interchangeably use the word program or project. And then of course, I did say to you earlier, or intervention. That makes it easier. So this is basically what I tried to illustrate in this algorithm, hoping that people who have the patience to go through it would have a clearer understanding. But in summary, a program with sub-programs is a program and project. There are no sub-programs, it's a program and or a project or an intervention, take your pick. So the details, I put them here in this algorithm that would help anybody who wants to go through the details to summarily categorize the utilization of program and project and why it is at some point used interchangeably. Now, let's look at now the strategic planning management proposed methodology. Before we go through looking at the different levels of the hierarchy or the model, the big question that always comes up is, at what stage do we believe that we are accordingly using the appropriate level of the model? How do you know what level of the model to start with? And that's a big, big question, and which is very relevant, by the way. And if you say, look, these are the different levels of the hierarchy that one needs to follow, the next thing you need to find out is, how do I know where to start? And this algorithm helps you do that. And what I have established here are different levels in terms of the approaches. Basically, this is what we call operations research. I have tried to methodize it and I've tried to make it more reader friendly. So when you look at it and follow this algorithm, you have a good understanding of where in the model do I fall in. And in the first box, we have an inclusive program design team. I shared to you in 2 or 3 slides earlier how important the composition of the team is when you look at the program cycle. Now, what we have going on these days is we have the top-down approach that I try to discourage. And when you talk about an inclusive team that I'm informing here, you're looking at the bottom up. It's not just the experts coming to tell us what we need. You also need to get full participation of the beneficiaries, the stakeholders, the key informants. Make that part of the effective team. And until they become part and participate, they are left out, and they will always feel left out, regardless of the level of success. So that's where you start. Now, once you've gotten that done, then the next step is, instead of sending money from the donor country to national government to these communities, you then say, but what do we identify with as our problem? Do we know what our problem is? In many cases, or in some cases, they have the right problem. In some cases, they may not have the right problem. We're going to find out how to differentiate as we move on the algorithm. Then after you're done is you find out what the problem is. Again, remember, we're starting with an inclusive team. Once you find out what the problem is, you then actually identify the gaps. We know this is the problem, but what are the gaps? What are the weaknesses? What is it within our framework that we need to address? Those are the gaps. And for you to do that, you then do operations research. Operations research is what I call here formative research. Formative research gives you an opportunity to, first of all, confirm those problems that were identified earlier. And then secondly, identify the gaps consistent with what had been identified. In some cases, they will agree. In some cases, they will not agree. But you need that operations research to help you not just identify the gaps and the problems, it also helps you identify what level of the ladder you will start with. Because if you don't identify those gaps and through operations research, you convincingly agree or conclude that given what we know, what we have and what we have achieved, when you go through the hierarchy, you don't need to go to capacity building because the capacity is already there based on our operations research. Now you look at the level of accountability. You say, oh, well, there are questions about accountability. Then, there and then, you know that when you go to implementing the model, you don't go down to capacity building because the capacity is already there. You go right straight to accountability. And within accountability, what are the strengths and weaknesses? This is what operations research helps you do. And this is what I call here formative research. You build on what you've experienced and you use that outcome to actually put together your program. And now, once that has been conclusively documented, we then move to putting together what we call a strategic framework. What is a strategic framework? Strategic framework simply says, now we know what our problems. Now we know what needs to be done. The big question is, how do we do it? And that's where strategic framework comes in. Strategic framework is a how. You know the problems, but how do you address them? And then strategic framework, it gives you an opportunity to quantify, in some cases you can qualify too, what you have collected. And when you take that qualified data, you then try to incorporate them in what we call the different levels of a strategic framework. The word strategic framework seems to be quite generally used by many implementing agencies, the EU, for example, and many UN agencies. Some have a different word that they use, like USAID, they have a different terminology, and even UNDP, they have a different terminology for strategic framework. And in this case, we use a framework that is, so I'm using it here generically, depending on who you're dealing with, you'll have different terminology. There is what we call the log frame. Log frame is quite common, and the one that is used by USAID and UNDP. So you then feed all these gaps, all these issues that you've identified through your formative research, and you put them in a more structured form. And if you remember what I was talking about before, about standardizing, here is a case in point. Things are now standardized. And for a given strategic framework, you have different levels. There is what we call the output, there is the outcome, and there's the impact. And these are all levels that are not just hierarchical, they are also causal. They also have causal effects. If you effectively or logically achieve your output, there is a good chance that your outcome will follow. And the same applies to the impact. I told you about my experience in many countries where they want me through an evaluation to establish impact. And I said, given what you have and how much time you put in and what we see, it's very difficult to achieve impact or to confirm impact at this point. The process may be leading there, but it's not definitive in terms of conclusive. And you leave it at that. So these are the different levels or the hierarchies of any strategic framework that you would find. That moves on then to add indicators. Now, once you've gotten that put in your strategic framework, it gives you now an opportunity to bring in your M&E, and M&E becomes what I generally call a complementary strategy. M&E is a program management complementary strategy. When you put together a strategic framework, you don't do it in isolation. You got to realize that whether you're talking about quantitative or qualitative data, they're going to be collected and they're going to be followed. And by following, you're going to find out, by monitoring, you're going to find out, are we doing it right? What do we need to modify? Why do we need to change? All those coming within your M&E initiative. And remember this, many implementing partners agencies, even at this point, it was even more common about 10 years ago. M&E came as an afterthought. But M&E is becoming more and more acceptable now, and people try to incorporate them at the development phase of a program. And that's the way it should be. It should not be an afterthought, it should be an inherent part of your program. Then once you've gotten all that put together, you've got your strategic framework, you have your M&E plan put all together, you now have a document plan, or what we call a program document. And your program document is supposed to document everything that you plan to achieve within the next 3 to 5 years. Anybody looks at that, they see a pathway, they see a way forward. And remember this, I did talk to you about midterm evaluation and final evaluation. Before you even get to midterm and even final evaluation, M&E plans are already a good complementary strategy to help you identify where are we going, document lessons learned, and be able to redirect as you move on. There's nothing wrong with that. You redirect because things do change. Don't forget. My model is based on environmental dynamic. And if there are changes at the environmental dynamic level, you can't just leave your program the way it was 3 years ago. There are natural disasters. And we now have, for example, the COVID. Some people had a plan. They have a program. Nobody saw the COVID. Now you go to your MME and said, well, we didn't see the COVID. So it's not business as usual. And there are certain modifications that at this point, we need to structurally change. And that's what it means by environment. It means by a conducive environment. Things that move on with the dynamics of the environment. And after you got that done, you got a program document, then you move on to the program implementation. And if you look back, when I was talking about the program life cycle, you see where program implementation comes in. And the message now from this is there are actually two, if not more. The first is this model here, this methodology helps you identify at what level of the carrot model do I start? This tells you. The second, of course, is that you put together an M&E plan that is sensitive, that would change if conditions change. We talked about an enabling environment in the model. And if this enabling environment does not exist, for example, the COVID that just started, you cannot just assume that you're going to achieve your objectives or your indicators as you plan. No, it's no longer business as usual because the environment has changed. So this is something that you need to be aware of. And that's the methodology. Now, we move on now to the next slide, which looks at what I had discussed earlier. And now we are now moving closer and closer to what we expect in terms of the model. I'm not going to go through details of Abraham Maslow's hierarchy of needs, but I just need to show you here the breakdown. And as we go through my model, remember that the model is driven by conceptually by this Abraham Maslow's model. It starts with the psychological needs and moves on gradually to self-actualization. You can see the pyramid there with the different descriptions. Maslow has 5 levels. I have 6, 7, and we're going to see what the differences are. But conceptually, there are similarities. It's not the same, but there are similarities. And that's what I'm going to share with you. And this is the model. Before I go into the details, I will try to share with you the picture, the graphic element of what it is. Now, if you look at it, there is a circle there that represents enabling environment. And within that circle, there is a pyramid. This, by the way, is the front cover of my book. And within the pyramid, there are interesting things in there. I have identified the different determinants that would help you define, the 6 determinants that would help you define the model. And I did show earlier to you what tool you need to use to be able to decide at what level of the model do I start operations research. Now, what we have here is we have a system, or what I call a graphic system of what the model is. For those who have a photo, if you look at the right-hand side of the pyramid, you see a bus. And the question is, what does that bus represent? The bus is a metaphor. For those who are conversant with the slave trade, those slaves who escaped from the US to Canada, we tend to use the metaphor on a ground railway. In this case, my metaphor is a bus. And why a bus? The reason was very simple. I looked at different transportation systems, and I was limited to 3, either by air, either by bus, or by train. There are actually different diversities, but I didn't want to exaggerate. And I said, well, if I'm going to move from building capacity to transparency, transparency is the highest achievement. Just like in Maslow's case, self-actualization is the highest achievement. So look at it in that context, conceptually, starting from basic needs at the bottom of the ladder. In my case, the bottom of the ladder is capacity building. So then I said, okay, if I'm going to move from capacity building to transparency, and by the way, I need to highlight one simple experience. As I was going through building this model, in many, many cases, people I talked to, when you ask them, why do you believe development aid or helping vulnerable communities has not worked? That's a negative way to look at it. And the consensus, I would say, in over 80% of the time, what people always said is this: there is lack of accountability and there's a lack of transparency. It came up all the time. Even in literature, if you look at literature, it comes up all the time. There's limitations in terms of accountability and transparency, which are correct, by the way. But then I sat down, and as I got through, I said, you don't easily move from capacity building to transparency. In between, they have to be other contributing factors that build towards coming up to transparency. And that's how I was able to fill in between transparency and capacity building, all those other elements. And of course, without ignoring the importance of an enabling environment. We will not achieve any of these if the environment is not there. And what we mean by environment, we'll see that as we go through the details of the model. So then coming back to the history, I said, okay, give it the 3 options: by air, by bus, and by train. By train would be very fast. And it's very unlikely that if I'm actually using that as a metaphor, there's no way I can achieve that by train, because in the flip of a heart, it will be gone. Would have achieved it. It's not practical. Then I looked at the train option and I said, well, you don't really want to be as slow. Generally speaking, trains are quite slow. There are, of course, the exceptions of the expresses that I exclude. But you take the slow trains, because of their stops and speed, it's very, very likely it's going to be non-ending initiated. And then I settled for a bus. And then in this case, the bus would identify 2 issues. The first is the word bus, as I indicated earlier, is a bottom-up strategy. You're starting from capacity building, that's the bottom, and going up the hierarchy to transparency, and that's the up. So you're going up. And so that's the acronym. And then of course the bus itself, as you can see, it's going up the pyramid. And as what that symbolizes is that if you're actually building a model that is going to help vulnerable groups, when you start at the bottom with capacity building, you got lots and lots of interest. And then you train them, whatever level of training you plan to give. Then after the training, you do an evaluation. And that's where the bus comes in. Through the process of evaluation, not everybody succeeds. So the bus then takes those who succeed and move them to the higher level, which is accountability. And then accountability gives them an opportunity to account, to actually prove that they are conscious and they are practically efficient to execute whatever tasks that are given to them accountably. So you find out at that level too, that not everybody, of course, is efficiently doing what is required. You take those who survive, put them on a bus, and then you move to the next level. And you see, as you move on the level, the hierarchy or the pyramid becomes smaller and smaller. So by the time you reach transparency, if you started with, say, 3,000 people trained at the capacity building level, you will hardly reach 20, 30, 40 at the transparency level, because they are going through tasks that are challenging. They're going through tasks that need to be accomplished. So you need a process. As I said, always remember, we're dealing with processes that would enable them, for those who succeed, achieve what we're looking for. And that's where the bus comes in. And so that's where the description of the methodology signifying the bus and its role in the model. And of course, the rest are the different causal errors that tell you what happens if this is achieved. Next. I'll go through now to definitions. Now, we start with the enabling environment. In this context, the enabling environment is the availability of appropriate, relevant, and sustainable laws, policies, political stability, advocacy of effective coordination mechanisms, and strategies to enable the successful realization of plan objective or outcomes and contributing to an overall higher goal. By overall higher goal, we're generically looking at the strategic framework where you're starting from the outcome, moving to the higher level, from the output, moving on to the higher level of the framework, which is the outcome, and then to the impact. That's what it means. And remember, I also talked to you about the changing environment. It doesn't specifically say here, but you do realize that there's an implicit understanding here. This is more when you're looking at laws from a bureaucratic perspective or political perspective. But there are natural disasters which also can change the natural environment. I also gave you an example of the COVID. And if the COVID were to come up, you wouldn't count on the executing your program without considering the effects of the COVID. Now, we now look at the details of the model. Always remember, we're starting at the bottom of the ladder and going up. And one definition that I'm going to share with you here is the following. Starting at the bottom of the level, we're using the bottom-up strategy, and capacity building is the lowest level. What do we have? Capacity building occupies the lowest rung of the current bus model. The concept of capacity building refers to both the development of an individual or a group of citizens as a whole to perform tasks they themselves can sustain, which enable them to grow and improve in educational, know-how, and economic terms, and in their willingness to exercise social responsibilities beyond those dictated by family kinship mores, religious precepts, and social norms of their ethnicity. So there are certain issues that you need to be sensitive about when you do build capacity. In this model, key components of capacity building include workshops, training program, skills update, operations research, community mobilization, appropriate campaign activities, and creating community awareness. Awareness, as we all know, is necessary, but it's not always sufficient. The reason why this is crucial has something to do with actual experience, wherein aid funded by programs could not deliver results on time due to lack of government capacity. I do say government capacity here is quite limiting in terms of implementation. Capacity in this context actually refers to those participatory vulnerable members who are going to be part of your intervention. You need to build the capacity. If they are going to be part of the intervention, they should know where we're going. And this is where it comes in terms of capacity building. So it should be as inclusive as possible. Even if the community stakeholders or beneficiaries are not going to be daily involved in the active achievement, they are going to be aware in terms of what is going on in their community. And that's the definition of capacity building. Now, the next level of the model is the accountability. So one author defines accountability as follows. The concept of accountability is to ensure that individuals, communities, NGOs, government and donors are aware of what it is they are expected to do or accomplish. You see, the list is quite inclusive here, as you realize. A senior international executive, Tobin Reed, used the acronym SIMPLE to emphasize the meaning of the word accountability. Setting of expectation for S, and I is the need to invite commitment. With M, I'm looking for the acronym SIMPLE, a way to measure process. P is a provision for feedback, and L is a link to reward and punishments. We're going to see how this contributes to the next level of our ladder. A second management plan must have precisely defined consequences for producing both the right as well as the wrong results. Evaluation of results. We always have a tendency of evaluating, of highlighting what has not gone right. And I do believe that's an overshoot. So let's move on now to the next determinant of our ladder, which is the resources. The resources in this context, based on my review, are defined as normally consistent of the written plans, funds, material, equipment, technologies, training needed, and or expertise necessary to produce the desired results. Now, before I continue, the question that comes on is, why do we import training in resources now? And the answer is very simple. Those levels of the hierarchy are not mutually exclusive. The fact that we did resource capacity building at the very, very basic level does not exclude capacity building at the other. It contributes. It's a very implementing factor that is part of where you are. Before you came to this level of resources, you came through that process of building capacity. So you're not isolating that. And that's why at this level of resources, we mention training as needed. And of course, with time too, people's knowledge become rusty and things improve. For example, talking about technology, there are certain advancements in innovations in technology that have come in. You don't go back to capacity to start implementing those. You go back, you continue where you are. And that's also a part of training. The timely delivery of essential resources is also part of this conundrum, and designing and maintaining sufficiently flexible administrative systems through which the aforementioned physical and technical resources are most effectively delivered is usually a mutual challenge. Nothing should be taken for granted. We know what the differences are in terms of trying to use scarce resources. I take you back one step to my strategic framework. In the strategic framework, I had a tendency of emphasizing results, talking about output, outcome, and the impact. But you do realize, of course, that before you get to the output, there's what we call the input, and there's what we also call the resources or the materials. Resources talk about materials, talk about the human resources. All those are requirements that are essential for you to get into any output. And all those, you consider them as inputs. They are actually what you would require to achieve those outputs. And so I didn't highlight that, but remember that they're also part of your framework. A significant gap often exists between the provision of essential resources and accountability for their value when delivered. Now, as I indicated before, we're looking at different levels, and the levels are not mutually exclusive. When you get to a next level, and always remember, the concept is exactly similar to that of Abraham Maslow. When you get to the next level, you are not isolating the precedent or the antecedent level. They are all in uniform consensus and moving up towards, you building them towards transparency. So that's the definition of resources, quite broad too. And then because with those resources, you are now able to achieve results. And what's the definition of results in this context? Whereas the first three elements, capacity, accountability, and resources, are often grouped together and labeled as inputs, a result is the first of three outcomes, the others being ownership of the development process, which is sustainability effect, and transparency throughout the development process. The word result also contains an element of ambiguity. The result may also be variously defined as a specific output, a more general outcome or purpose, or as the achievement of a broader goal. The first law of results is that each one has to be quantifiable in order to be measurable. That's true. We also, remember, do collect qualitative data, but that's usually quite difficult to measure because of the subjectiveness. These can either be intended or unintended, positive or negative. The creation of ownership and the achievement of transparency, while also results in some sense, are usually more difficult to define in immediate and measurable terms. Now, what this is all telling us is that whatever it is we're doing, the generic outcome or the generic output that we're looking for are results. And results, depending on the different levels of the strategic framework, looking at law firms, for example, they're defined by different terminologies. Output is a result, outcome is a result, impact is a result. These are all results, and they add up to bringing us to where we finally want to go, which is a goal that we hope we can achieve. So for us to get results, there's a bigger challenge when you're dealing with qualitative data. There is a tendency to identify results, whether output, outcome, or impact, with qualitative indicators. Now, qualitative indicators are necessary, but they are not sufficient. We always need qualitative data to complement what we quantitatively have arrived at. So always remember that. We would look at emphasizing outputs by using indicators that are quantitative, same with outcomes, same with impact. However, we should also remember that the importance of qualitative data cannot be overemphasized. So after results, we move to ownership. Now this team now has been able to develop results. And we're now saying, well, if you are able to come up to this level of developing results, we believe that at this point, you are ready to run the show. And now it would be yours. And ownership is a very, very critical aspect of this model. I'll give you an example. If you look at remittances and you look at diaspora, billions and billions and billions of dollars are being sent by immigrants to their countries of origin. Compared to what we currently experience in terms of success with regard to helping vulnerable communities in our program intervention, there is no comparison. And why? Because the level of ownership, there are other reasons, of course, but one key factor that one cannot marginalize is that the level of ownership between these diasporans and the recipients or their connections in their country of origin is extremely high. It's very appreciative. There's a lot of trust. And interestingly, what I discovered as I was going through the research is most of the billions of dollars that are sent by these diasporans to their countries of origin, they go towards either education or households, building homes. So, and needless to say that the effectiveness is completely, completely impressive. And for those who've had the experience or who have been part of it, you all know you don't need any more evidence to convince you how successful remittances have been and why these recipients, they know it's ours, they know it's a show that will run, and they go on and do exactly the required managing our program, lack of ownership. And I'm saying in this model, associate ownership only when they are able to achieve results. When they are proud of their achievement, ownership then follows. And how do I define ownership? This word is often fraught with ambiguity. I talked to you about the Paris Declaration earlier. The Paris Declaration placed emphasis on ownership as referring primarily to developing countries, governments' ability to exercise leadership over their development policies and strategies and coordinate development actions. Since then, the international dialogue has recognized the need for broader definition of ownership. You don't need to go very far. I just give you an example of the remittances. The Accra Agenda for 2008 expanded the concept of ownership from merely the executive branch of whatever host government and donors have was dealing with to a broader society of that donor. To a broader society of that country as owners of a development efforts. And as I said to you earlier, unless you own it, you do not really consider it part of the ownership. That's ideally what should be. But because of the intricacies and complications and nuances that come with money and funding, we try to structure it and move it up to a baseline, which is results that would help us assess at this level that they're able to accomplish results. We believe, rightly or wrongly, that's why I said it is ambiguous here. That's the level of ambiguity. Rightly or wrongly, they have now reached a level at which we should declare them owners. And finally, transparency. Once they have reached that level of ownership, transparency becomes obvious. You don't need to be informed or to be told what to do. They have already walked through the journey and they have already reached a point where they are autonomous. They have achieved. And as Maslow says, it's self-actualization. I've reached the top. And this is what definition I got. Transparency in foreign aid assistance is defined by Moon and Williams as comprehensive availability and accessibility of aid flow information in a timely, systematic, and comparative manner that allows public participation in government accountability. Now you see the word accountability here. We looked at it right at the bottom, but it refers to it here right at the top. It says before you get to the top, make sure that's part of it. And as I indicated to you earlier, my experience dealing with experts, colleagues, and knowledgeable people, the tendency was always to say the deficiencies are accountability, lack of accountability, and transparency, reflecting it here. Ideally, transparency assumes everybody involved in the development program is capable and well qualified to adhere to management and physical accounting systems and to execute approved plans. See, there's an assumption that my model does not take for granted. And that's why you start by building capacity. Are you moving on to accountability? Are you moving on to results? Are you moving on to ownership before you ever get to transparency? So it's a process and a long journey that cannot be taken for granted and that cannot be assumed exist. Again, bringing you back to my operations research, it's important. It may be that after conducting operations research, you don't need any training or to build capacity. We don't even need accountability. We just need to say ownership. How do you sensitize or build up a community to be able to identify with ownership? Talking about remittances. Remittances, ownership is already there. So if you're dealing with that, you don't go there and you try to establish capacity or accountability because the ownership is already there. So you move on from ownership to results. And it's only at that level after ownership. Now I'm looking at remittances. After ownership, to achieve results, they improve their educational standard or they build houses. Those are results before you ever move on to the next level. So be aware of these achievements and try to sensitize or try to contextualize them based on what the challenges is. Now, another reference definition here, the references that I have here. Moon and William, comprehensive availability, accessibility of aid, flow information in timely, systematic, and comparable manner that allows public participation in government accountability. Ideally, transparency, as I indicated to you earlier, it's what we are expecting. So now this is simply repeating our definition at the transparency level. So now we move on now to the implications. I have generally walked you through the model, the different determinants, the limitations, the contributions, the achievements, and the expectations. Now, what we need to do now, of course, I did identify with you too who the potential stakeholders are, what are the target audiences. Now, one issue among others that we are going to look at now is what are the implications? Implications are quite many, and you couldn't document them in a simple lecture like this. So let me start with this. Many beneficiaries continue to live in squalid conditions. Poverty remains ubiquitous, despite reports to the contrary. Improved quality of life in vulnerable populations remains a distant dream. This is very grim, and also this is quite negative in terms of the way things are put. But the reality is that the differences between the very rich and the very poor, while some achievements have been made over the last several years using the MDGs, last year and more, we have been experiencing a lot of downfalls in terms of degrading achievements. What we believe we achieved, they are now falling down the drain. And that's, of course, compromising the quality of life and, of course, socio-economic dynamics of vulnerable communities. And that's the implication that we are faced with. Now, to continue, in terms of implications, above all, Western countries have failed to meet their own pledges of donating 0.7% of their GDP to low and middle income countries. I'll give you an example. Great Britain, sorry I got to announce it, Great Britain has recently cut down their foreign aid contribution. And I believe they were among the 4 out of all the countries, rich countries that came together and established a standard with which they said they agree to contribute 0.7% of their GDP to helping the poor. 4 countries that came up very, very convincingly, and they are still there, are the Scandinavian countries. Scandinavian countries are still the very few that contribute 0.7 or more % of their GDP towards foreign aid, towards helping the vulnerable groups. And as I indicated, Great Britain, on the other hand, they recently cut down their financial support, and that's not helping. Only 7 countries have either achieved or exceeded this objective. This is what OECD said. And I said, most of them are the Scandinavian countries. When I put this together, Great Britain was there. I don't believe they are there any longer. So this brings the number to 6. This framework attempts to improve program management challenges. Carrot Bus serves as an antidote to sustainable quality of life. So this funding notwithstanding, when you have a methodology or a strategy that helps these contributions, it can only improve people's quality of life. And that's the bottom line. And that's what the model does. What is the justification? Now, look at the justification of the model. Above all, Western countries have failed to meet their okay, sorry, I used the wrong slide. Informed readers would notice a close similarity between Carrot model and Maslow's hierarchy of needs. I already mentioned that to you earlier, that conceptually, this model is similar to Maslow's hierarchy of needs by identifying the basic needs at the bottom of Maslow's hierarchy and self-actualization at the top. In this case, the bottom of the pyramid is capacity building, and at the top is transparency. So I'm saying here, informed readers will notice a close similarity between the Carrot model and Maslow's hierarchy of needs. This is conceptually, which is also illustrated by a pyramid with bodily needs at the bottom of the pyramid and spiritual needs at the top. Starting from the bottom, going to the top, you will see what the needs is. Spiritual needs is self-actualization. Bodily needs are human needs at the bottom of the model, of the pyramid. Maslow's model is so basic to social science that all readers must be familiar with it by now. However, it is familiar because it is so useful and an excellent reminder of why and how we do need development work. So I try to look at those similarities and the justification. Like Maslow's hierarchy of needs, Carrot Bus is essentially a model with human dimension. It's a humanistic-based model. It is well to remember that those higher up the pyramid owe a debt to those further down it. And it is the needs of those below and level of self-actualization that count the most. So we're now saying that when you get up the top of the ladder, whether you're very wealthy or you're very poor, it's always good to be aware of what the journey and the level of achievements are. Continuing justification. It would be wrong for donors, for example, to try to have their own needs for belonging and esteem met by development projects or focus most be on our clients. So what we're saying here is that our focus should not be on what the donors say, what is it for us, but the focus should be on the beneficiaries, something I said to you earlier. Our job essentially is to make sure that all basic needs are met throughout the world so that all of humanity can make it to the top layer of the pyramid. Self-actualization in Maslow's case and transparency in our case. Anything less perpetuates a state of injustice. It's also well to remember, of course, that donors have needs as well. We are aware of that. One of the self-actualization needs in the pyramid includes general relativity, or the ability to pass on wisdom, know-how, and even material possessions to the next generation. Again, that reminds you of the point that I tried to highlight several times. It's not an event, it's a process. You move on and you move on and you move on and you move on. That's what creates achievement. Looking at it from this angle, Western countries, by Western countries, we mean the donor countries or the rich countries that have scaled the development pyramid cannot continue to focus on the need for safety exclusively and should not be on over-satisfying their physiological needs when others are starving. So we need some level of sensitivity. Yes, you're rich, but remember that before you got there, you started from somewhere, and that there are people still down the bottom that are in need of support. And it should no longer be considered what is in need for us, but it should consider how can we help. And not just helping, we make the help long lasting. Continuing justification. It's also worth to remember, of course, that donors have needs as well. One of the self-actualization needs in the pyramid includes, sorry, I just read this over. At the same time, the drive for development must come from below. This is where the bottom-up strategy comes out. The time for trickle-down economics is long past, should not be top-down. We saw that earlier. It's not effective, it's not useful, and it doesn't give you anticipated results. And one of the things that I forgot that I did identify and I did emphasize is that while we're emphasizing bottom-up strategy, we should also remember that no intervention, no program is perfect. There are cases where you actually move on and you achieve intended results, which is good. But remember, there are also opportunities or cases that you achieve unintended results, which is also good, but not as good. Why are unintended results good? Very simple. If you cannot use them because you didn't plan for them, you cannot use them as unintended results and plan for your next intervention. And I did highlight lessons learned. So you can use that to improve your level of lessons learned by using unintended and intended results. So let's not be fooled. As efficient as we may be, we may not achieve the outcomes we're looking for. But let's not just close doors and say, dead on arrival. Let's see what is it that we can take out of it. That's important. Donors must acknowledge the urgency of their clients in order to forge relationships of mutual respect and trust. Otherwise, nothing will be achieved. For those of you who have had experience dealing with some of these rich countries, they sometimes get to a point where they give you the impression that, well, if you don't like it, too bad. There's so much I can do. That's not correct. And that's part of a wrong strategy. And that's exactly, again, one of the reasons why top-down approaches do not work, because you believe that you have the answers, whereas bottom-up strategies believe that the beneficiaries have the answers. So these two contracting or contradicting approaches need to be synthesized with emphasis placed on bottom-up strategies. Now, following justification, finally, this is why the current element, capacity, accountability, resources, results, ownership, and transparency are so critical. And as I said to you earlier, they are not mutually exclusive, and you just need to identify at what level you are by using operations research, and then you try to build and improve the social dynamics of any community by using that as a guide. Definitions are there as a guide. Any intervention can decide to put their own definition, but there must be a priori. You don't go back and you start putting definitions after you've started. Put them a priori. That makes it more scientific, and that makes it also more compelling, and in terms of effort, more challenging. Now, let's go into discussion. There is a substantial number of evidence-based reports supporting the high levels of social inequality and unacceptable quality of life in the airlines, and globally, in general, and low and middle income countries specifically. So we do find out that these problems or these challenges that we're dealing with are not isolated. I started in one of my slides by telling you that when we talk about vulnerable communities, not just the poor countries, whether I'm talking about Australia, talking about North America, US, talking about Canada, they do have the same challenges. They are vulnerable communities that need to be part of the agenda, need to be part of the paradigm. And that's very important. Geopolitically, there is a significant number of compelling evidence-based and anecdotal reports with some instances of dismal social inequality in many indigenous and vulnerable populations in some rich Western countries. I mentioned that already. Typically, Australia, Canada, and the United States. Efforts made by these governments to improve the quality of life in these vulnerable communities have been a colossal fiasco. And if I were just to start sharing with you what I have learned about what is going on in these wealthy countries with regard to how they are treating these vulnerable groups, especially the Aboriginals, you would be amazed at how things are working. And given what is going on now, the future doesn't look bright because the challenges are still quite enormous. And I'm not quite sure what the strategy is, but these rich countries need to rethink and actually introduce a paradigm change that is not going to be business as usual. So, continue our discussion. Results of foreign aid and international development continue to be mixed. I shared that with you earlier. There is both compelling anecdotal and scientific evidence that foreign aid outcomes have ranged from dismal to reasonable. There are some achievements, but there is room for more. Many beneficiaries continue to live in squalid conditions. Those of you who have experience will agree with me. I identified countries and very poor countries, and even in the rich world, there are populations that are vulnerable. Poverty remains ubiquitous, despite reports to the contrary. An improved quality of life in vulnerable populations remains a distant dream. Yes, we do have lots of challenges, and there's a lot of work ahead, and we need to emphasize more the importance of improving these people's way of life. Above all, the rich Western countries have woefully failed to meet their own pledges to donate 0.7% of their GDPs to low and middle income countries. Only a disappointing number of countries, 7, have achieved this objective, already shared with you. The Paris Declaration that was promulgated to address most developmental concerns has been quite disappointing and low. Conclusion. Results of foreign aid and international development continue to be mixed, so that there is both compelling anecdotal evidence that foreign aid and outcomes have ranged from dismal to reasonable. Many beneficiaries continue to live in squalid conditions. Poverty remains ubiquitous. Above all, Western countries have not made their pledge of 7%. The Paris Declaration promulgating to address some of these issues has not worked. Hence, there is an urgent need to consider other options. And carrot bus remains one of the few that exist, and especially as displayed by literature available, there are hardly any approaches or designs or models that come close to this. They're kind of isolated. They probably succeeded, but the challenges are still there. They are not comprehensive, and they are not quote unquote exhaustive in terms of let everybody be part of the agenda. That we are still a long way ahead. And part of Carrot Bus is an attempt to participate, to share in sorting out some of those challenges. And I'm hopeful that this initiative will have support from different groups and different ways of life. Thank you very much. All right, over to you, Desia. I think that should do it. Hello.
Thank you so very much. Bongs Lainjo, for taking us through that journey. And thanks to all the attendees who stuck it out. And again, thank you so much for a very rich presentation, which reminds us of the challenge of universal inequality, which is not limited to the global south, but which reminds us or re-emphasizes the need for targeted interventions, right? You carried us through the program life cycle. You spoke about, you introduced us to your model. The unique characteristics of the carrot bus model, which is a bottom-up strategy, reflecting good practices from many countries in which you have worked. And one of the things we remember you talking about is the importance of it being culturally sensitive and customized, tailored to meet the needs of the vulnerable communities within the local context. And so thank you so much for introducing us to this model. It's something that we need to explore in our own course. And I think with the very limited time that we have, I will now open the floor to questions and answers. So I'm just going to go encourage persons, if you want to post any questions, you can use the Q&A feature located at the bottom of the screen. But in the interim, while you do that, I believe there is at least one question here, Bongs, and I'm going to go in and just have a look and share that with you. So one person asks, isn't it better to have local program implementers rather than international implementers, since they will be more familiar with the local context and may have a vested interest in securing the interests of the beneficiaries, since activities in vulnerable communities may have national social implications? And that's from one of our students, Janine. So, you know, the question of whether it is to have local program implementers rather than international implementers. So, Bongs, would you like to take that?
I definitely would. And I couldn't agree with the question more, because when you look at that question, there are actually two responses. Let me start with the first response. When you have foreign governments send in their own citizens to implement their political overtures, and those political overtures tones remain very, very, very crucial. And I couldn't agree with the question more. And especially when you look at the model says bottom-up strategy, and that's exactly emphasizing what that question actually says. Then when it comes to implementing the program itself, because of the political overtones that come with the model, because government says, we have a contract, we want this contract to go to our citizens. And that's why that automatically cuts out those in the implementing countries, either by being beneficiaries or being national governments. They are commonly cut out. And that brings up the top-down approach, which exactly we're saying we should not be. What the solution is, it needs to be a dialogue. We need a paradigm change. And national governments need to remind donors or funding agencies that we, as recipients, we want to be part of the show. And by being part of the show, you look at example of what I said in my operations research model. You go back and you identify a team that is inclusive. Even if you're going to get in outsiders to come and help, they should be providing their help driven by the local citizens. And that's important. And I couldn't agree with that more. In my book, I have actually identified successful stories where this has happened. And if you had a copy of the book and you look at all the different levels of the ladder, you will see that for each level, from capacity to ownership to accountability, there is a case study that complements that. So yes, it's not foreign. Can it be done? Yes. But we just need to be given the chance. But there's a lot of political overtones at that stage that has not helped. And I'm hopeful that when countries start shouting loud, we want to be part of the agenda, people will listen. At this point, they're not listening. Even the Paris Agreement that we just looked at, Paris Agreement was good in paper, but practically it didn't work.
Okay, thank you so much for that. I know students with an international background appreciate mention of the Paris Declaration and the Accra Agenda for Action, which is something that is very important, especially when we're talking about the importance of local ownership. But just to piggyback on Janine's question and to kind of critique your model, Bongs, I noticed that you use words interchangeably while emphasizing the importance of making distinctions. Now, one of the concepts that I believe is the first level of your model speaks about capacity building. But especially when we examine the work of UNDP, we know that a distinction is normally drawn between capacity building and development. So I'm wondering, to what extent does your model recognizes the distinction, which is simply this: when you're talking about capacity building, oftentimes it's referring to building something new, something that doesn't exist, whereas with development, you recognize that there are existing skills and knowledge, and you are working to strengthen that or build on it. To what extent does your model recognize this distinction? Because I see where you use the concepts interchangeably.
Good. That's a good question. And I think that one of the challenges that we are faced with as part of the agenda is that capacity building, as broad as it is, continues to be an event. And that's the biggest challenge that we're faced with. The moment we convert capacity building from an event to a process, and believe me or not, millions and millions of dollars, including UNDP, have been spent on capacity building, various notations, various terminologies, but it boils down to improving people's knowledge. And the biggest problem has been, in many of these cases, it's been an event. And what my model attempts to do is, whatever level of capacity building you do, whether refreshing, whether starting over initially, or bringing in new concepts, it should be a process. And that's a process at the micro level. You have to make sure that you don't only go there and bring people to, because from my experience, and I'll tell you, unfortunately, you look at some countries where participants look at different capacity building or training opportunities. And you know what they do? They say, okay, I have 3 or 4 sessions that are coming on in different parts of the world. Which one gives me more per diem? And that's the one they go to. The one that gives me more per diem, I'll go to that one. As strange as it sounds, but that is it. And what does that mean? It simply means that the lack of follow-up, lack of making it a process, defeats the purpose of building capacity. And if you don't do that, capacity building as an event is a non-starter. And that's why we need to start. And donors to have a point, they have a problem. And this is an issue they need to address. People come up with programs and outlines and hardly a follow-up. What are you building the capacity for? What has been achieved? I mean, I have lots of examples where I've built a lot of capacity in my book. You even see photos. But I tell you what, while I'm building this capacity, I'm so happy and excited because I think I'm achieving something. In one or a few cases, when I do leave that part of the world and move to another part of the world, coming back to visit, you know what has happened? Those whose capacity was improved and built, especially the civil servants, they've either moved, they've either been relocated, or they are no longer there. So these are events and factors that those of us involved in trying to improve people's quality of life, we need to enhance. And I talked about intergenerational change. That's a key in point. And that's what a process does. Can I do that with an event? And that needs to remind us now and again that we don't just make capacity as a one-stop shop, we make it as a continuous attempt.
Okay, thank you so very much. And with that final comment, which I think took care of Morgan, our class representative's comment, we would like to thank you so much, Bongs Lainjo, for taking the time to share with us your wealth of experience from various perspectives as an evaluator, as an implementer, person involved in capacity building. We very much appreciate it, and I know the students can identify some fundamental principles, if nothing. See it as a process, not an event, which is one of the messages coming out throughout the entire presentation, and the need for close following up, monitoring, and so on. So thank you again, Bongs. We really appreciate you taking the time to give back. I remember you spoke about generativity. And there are elements of that wrapped up in that concept, which is loaded. But again, thank you on behalf of staff and students here at SALISES. And I just want to thank all the attendees for being patient with us and for attending today's session. We also thank those persons working behind the scene tirelessly to ensure that all these FSS at 60 events go smoothly. Richard Leach, Tony Marie Cornwall, Mrs. Yanor Johnson Hope, Rashana Mighty, and the rest of the team who continue to work towards ensuring that as SALISES forms part of the faculty, we are aiming to realize the REACH vision. So thank you again, everyone, and just to invite you to attend the next masterclass, which is today at 5 p.m. with Professor Warren Benfield, who will be talking about poverty reduction and evaluation in that context. So once again, thank you one and all, and have a good evening. Bongs, thank you again, and we will be in touch.
Thank you very much, and you're welcome. And share my regards to all the attendees. Wishing them all well.
Okay, thank you. Have a good evening, everyone. Cheers.